Hi everyone, Dr. Remy from Pain Free and Fit. Today we've got a great exercise for grade 1 spondylolisthesis in terms of pain relief and to improve your conditioning to stabilize your spine and prevent the pain from coming back. It's a modified version of the classic stir the pot exercise. Hope you enjoy it. So what I really love about this exercise, the modified stir the pot for spondylolisthesis, especially a grade 1 spondylolisthesis, is that it challenges a number of muscles on both sides of the body to help stabilize and hold that spondylolisthesis vertebra in a better position. Usually, remember, with spondylolisthesis, and especially what most people have is an anterolisthesis, the vertebra has slipped forward, either due to degeneration or laxity or some other problem. And we need muscular and fascial tension to hold that vertebra in a better position so it doesn't have stress on its associated disc fibers, muscle and tendon fibers, joint capsule, because that's what's causing your pain usually with spondylolisthesis. So what we're going to do before we do this exercise is make sure that we have good body alignment. If we typically have a tendency to lean to one side or twist our hips or pelvis to one side, we want to make sure we're not going to be doing that when under the challenge of a weight-bearing stability exercise, because most of us are going to go to our strengths, which many times is our biomechanical dysfunctions. So if you're not sure if you have a posture or stability issue with the lower back, I invite you to go to the Pain Free and Fit or Posture Size websites. We have a free body analysis there, and you can take that analysis and learn what do I have to do to hold my body in a better alignment position. So once we have that alignment, we're going to engage several muscles which help to support and are going to be trained with this exercise. The first is we're going to hold our lower abdomen in towards our back, that's under our belly button, and we're going to try to engage our multifidus muscles in our lower back. Those are the muscles that come off the sides of our vertebra. We have another video on our channel that I invite you to watch if you're not sure how to engage your multifidus. We want to make sure we're engaging that from right to left sides equally. And many times what that means is we have to imagine a pressure of, as our lower abdomen pulls in, it causes a bulging out right on the sides of those bony knobs in our lower back, especially the very bottom corners, right and left. If you have weakness on one side, I suggest you focus that tension of your lower abdomen pulling in towards that weaker side so you can feel an equal bulging out right and left. That's going to help to stabilize your spondylolisthesis. If you're just feeling a bulge on one side, that's going to be pulling that vertebra off center, and that's many times causing your pain. So what we're going to do is we're going to use a Swiss ball for this exercise, and we're going to allow our forearms to rest on the ball and then our chest to rest on our forearms. And the object of this is we want to make sure that we're pushing our chest through our forearms in an effort to crush the ball down, okay, to flatten it out. I engage all my alignments. So again, if I hip hike or raise one hip on one side or have a tendency to twist my ribs or pelvis, I want to get my alignment straight before I pick my knees up. I'm going to hold a little lower tummy in, engaging both the transverse abdominis, that lower abdominal muscle, and my multifidus muscles, focusing on that bulge sensation coming off my spine. And then I'm going to exert a little tail under. Do you see that tail under pressure I'm doing? Tucking my tail between my legs. Only do that to a comfortable amount. That's going to engage your abdominal muscles, okay, the more superficial ones like the rectus abdominis. And then I'm going to put both knees up as I'm on my feet. And the way I make this exercise very intense on my abs is I'm going to, as I continue to push my chest down, continue to tuck my tail under and raise my tummy up off the ball. Okay, so my chest is down, but my tummy is up. You're going to feel your abdominal muscles contract with that. And then I'm going to stir the pot, meaning I'm going to make a little circular motion with my forearms into the ball. You're going to feel all your abdominal muscles contracting equally. You're going to feel rectus abdominis in the front, the obliques, the whole abdominal area is involved with this. And then I'm going to raise one leg slightly up. You see how I pulled my one leg up? As I stir the pot, I'm going to squeeze that back buttock of my elevated leg. And I'm going to make sure I keep my tail under. Because the tendency is, as I raise the leg, the low back's going to want to arch and the tail's going to want to pop up. I don't want that to happen because that's going to irritate my spondylolisthesis. So again, I've got tail under, raising the leg a little bit, squeezing that buttock. So what I'm doing here is I'm engaging both the back muscles like the erector spinae longissimus and iliocostalis, I've got the lower tummy in, which is the transverse abdominis, and I've got the multifidi muscles contracting as I'm doing this exercise. That's a powerful way to engage abs and back muscles simultaneously, and making sure that you have enough thoracolumbar fascial tension, which is exerted by the lat muscles that are contracting as you're pushing down, as well as the buttock muscles, to help hold that vertebra in place and coordinate proper motion between the abs and the buttock muscles. If I didn't have the tail under as I'm pushing down, the leg is going to come up and we're going to overarch the back. That's going to be more back activity. That's going to be extension or overarching the back. That's going to irritate. So the whole key with this is you're challenging the abs much more by raising one leg, not only in terms of balance, but in terms of recruiting the proper back muscles. This is a great exercise to do for increased repetitions, meaning I can make my circles to one way and then counterclockwise them to the other and build up repetitions as my workouts go on. 2 to 3 times a week. This is a great exercise. It's wonderful if you could build this up to spending about 1 to 3 minutes between right and left legs to build up those muscles to help with your spondylolisthesis pain. Many times if you do this over a course of weeks to months, the tendency for that bone to slip forward with your activities because you're using balance in what we call a proprioceptively rich environment, along with strength training and proper posture and neuromuscular coordination and efficiency, it really helps to start decreasing your pain, increasing your stability with day-to-day motions, and it's a great exercise if you're suffering from especially a mild grade 1 spondylolisthesis. If you like this exercise, there's a lot more on our channel. Please feel free to subscribe to it. I would highly suggest it. And again, if you have any questions or comments, leave them below and I'll do my best to get back to you and answer them. Hope you enjoy it. To a healthier back and a better spondylolisthesis.